for a change in gear here. Vascular imaging, the options are CTA, MRA and Doppler ultrasound. CTA is a lovely way, especially with the current technology scanners, first-line imaging for thoracoabdominal aortic aneurysms, for the assessment of large vessel atherosclerotic disease. It's great for kidneys and peripheral arteries, but the one bummer is that they need to have good renal function, and often people who have atherosclerotic disease don't have good renal function. So that's why we often end up doing, for instance, Doppler ultrasounds, a screening test for the lower limbs. But if I had normal renal function and I had intermittent cortication, for instance, I would prefer to have a CTA of my legs than a Doppler ultrasound, all other kidney function being equal. Gives you a lot more anatomical detail and accuracy than Doppler. But Doppler is a great first-line screening test. MRA, great for the brain arteries, and I would say you should, if you're worried about, if somebody approaches you, they have a family history of aneurysm, or you're thinking you want to just have a look at the vessels of the circle of Willis for some reason, MRA is the first line. CTA gives you lovely detail of the vessels of the circle of Willis and can be used as a problem-solving tool. But again, it gives you the radiation, you don't need to have that, and also it can be a little bit more difficult sorting out the bone of the skull base from the carotids, particularly near the skull base for little aneurysms and things, whereas MRA you don't have that issue. So here's an example of an MRA. You can see that all the bone of the skull base is effectively subtracted and we get this lovely information. This actually is a fusiform broad-based aneurysm of the left ICA here. That sort of aneurysm will be quite hard to see on CT. You would see it and you can certainly characterise it quite nicely, but you'd have to look a lot more closely, and you can get more artefacts on CT as well, makes it a bit more difficult. CTA of the aorta, don't really need to explain that, shows you great detail, all the branches and small vessels as well as the large branches. This is one just from the other day. This is a young person who had poorly controlled hypertension, and this corkscrew appearance of the kidney is classic fibromuscular dysplasia. And this patient actually had a Doppler ultrasound which showed an elevated velocity, but it doesn't give you, the Doppler tells you there's a stenosis there, but it doesn't tell you the why, which was that there was FMD there. Of course, carotid ultrasound we're all well and truly familiar with. Again, it's not giving you highly detailed anatomical information of the plaque, although with today's quality 2D imaging, you can get a pretty good idea, and we have very well established criteria to look at carotid stenoses. And I would say that still carotid Doppler ultrasound should be your first port of call if you're wanting to screen the vessels of the neck. MRA, not so good for the vessels of the neck, better for the intracranial vessels. CT, you could do both, but calcium at the carotid bifurcations can make CTA of the carotid vessels quite difficult to interpret.